What is the number one cause of gastritis, stomach issues, reflux, heartburn, ulcers? Let's find out, and what do you do about it? Hello and welcome to another edition of the Ask Dr. Pickel Show. So today we want to get into the big cause, the documented cause of all these different stomach issues that you hear about, that you may suffer from, that your doctor may diagnose you of, and hopefully they are looking at this because this is in the research the number one cause. And again, what do we do about it? So let's dive right in. Basically, this is a bacteria, and you may have heard of it. It's a bacteria called H. pylori, Helicobacter pylori. Now, the CDC says 66% of humans with stomach issues have this infection. Now, in developing countries, that even goes up to more like 80%. So it's a very, very common thing to have. And in fact, the stomach issues, stomach problems are extremely chronic in society, especially in the United States. And people are usually given prescriptions to try to help decrease the symptoms of these, but the cause is rarely dealt with. And the problem is if you have gastritis, which is inflammation of your stomach, if you have stomach ulcers, if you have GERD or reflux, heartburn, chronic indigestion, these issues, biggest cause is this bacteria, but it's just not talked about very often because there isn't much treatment for it. All right, so what could be your symptoms here, which I've kind of delineated on this list? Heartburn, reflux, bloating, belching, gas, nausea, vomiting, diarrhea, constipation, a bad breath, or what they call halitosis. You could even get a loss of appetite, or you may find that, hey, I just ate that meal and I like a little bit later, I'm already hungry again. So these can be things that go along with this. All right, so what does this bacteria do? Well, this bacteria, it doesn't just float around in your stomach. It doesn't move along the inside of the stomach. It's under the mucosal layer. Our stomach on the inside is lined with this mucus, and under that mucosal layer is where this lives. Now, here's the problem, is this bacteria likes to attack the cells in your stomach, especially what are called parietal cells. And the problem with that is that affects your ability to make stomach acid. So what happens if you can't make stomach acid? Well, a lot of bad stuff. So you actually need stomach acid, and we'll talk about why here in a minute. The other thing that it can do is this bacteria can move to blood vessels and start to damage the inside of blood vessels. This bacteria will just continue to produce inflammation in your stomach. Now, what happens if your stomach's chronically inflamed and you decreased acid production? Well, the mucus layer starts to break down, the wall of the stomach starts to break down, and then that can start to turn into ulceration, where now it's like raw stomach tissue with acid hitting that, which does not feel good at all. And then, of course, you can get diagnosed with that. Now, what happens is if your stomach cells, your stomach tissues are chronically inflamed, those cells start to change. They start to divide differently, and this is called metaplasia. So that's why, if this goes on long enough, you increase your risk of actual stomach cancer, which you don't want. But it all starts at the very beginning, and it's actually dealing with the cause, which we'll get to. Now, so what happens if you don't have enough stomach acid? We have to have stomach acid. When you watch those commercials and they say, oh, you've got heartburn, you've got reflux because you have too much stomach acid. Well, that's not really telling the whole truth. The thing is if I eat a sandwich, it goes to my stomach. The acid in my stomach is what breaks down that sandwich, so it can be later absorbed. And the problem is if you don't have enough acid, that sandwich just starts to set in my stomach. The problem is the inside of my body is about 100 degrees, so that sandwich starts to ferment. It actually starts to rot. I know that sounds horrible, but when it rots, it makes bad acids. It makes gases from fermentation. So what do I get? I get belching, burping, bloating, gas, but also I get these bad acids. In our stomach and our esophagus weren't built for those bad acids, so they can start to burn and they can start to reflux, start to get a problem there, which we don't want. So then we don't digest our foods properly. when you release stomach acid, that actually stimulates your pancreas to release digestive enzymes to help break down your food. When you release stomach acid, that's what stimulates your gallbladder to contract to release bile. What if that doesn't happen? Number one, I don't have enough bile to break down fats and oils. But number two, all that bile just stays in my gallbladder and eventually starts to maybe harden and turn into stones, or the gallbladder gets inflamed, different possibilities there. And then also, if I'm not digesting my food in my stomach, it doesn't absorb in my small intestine. So now, except for the sugars and carbs, but then you start to get a blood sugar problem. But the thing is if I'm not digesting proteins, fatty acids, minerals, vitamins, then I start to get malnutrition, malabsorption. My body starts to become deficient in a lot of different things. And then I start to get all kinds of other conditions because of this. And then also if my food's not digesting in my stomach because of not enough acid, then it starts to affect my bowel movements. So if I've got food that's not digesting, it's either going to cause more diarrhea or it's going to cause more constipation. And it can again start to inflame the small intestine too and the large intestine. So this can just cascade into all kinds of different problems that we don't want. Now also think of this, the acid in your stomach, what does that also do? That's your first line of defense. So if I go to a restaurant and they didn't cook my food very well, or the guy that made my food didn't wash his hands after he had a bowel movement, and then he's cooking my food, I know it sounds gross, but it happens all the time, and I eat this, what's the first line of defense? The acid in my stomach. Because what should that acid do? It should zap invaders, parasites, bacteria, all these things, so they do not enter my system. But if I don't make enough stomach acid, what happens? Hey, these guys can just come right into my system, and then they start to cause all kinds of other health problems. So we have to look at that perspective too. So how would you diagnose something like this? Well, a lot of times by symptoms, if you're having those symptoms I've listed, but also you can do what's called a breath test. And that's where they will have you breathe into a bag, you'll drink this liquid, and then they'll have you breathe in again. And then you'll see if you get the gases that these bacteria make. And so that can be a positive test. Another way to test it is a stool test. Now the problem is if the bacteria, if this H. pylori bacteria is down a little lower, sometimes it will only appear in the stool and not in the breath test. Sometimes if it's up higher, it'll appear in the breath test but not in the stool test. So these tests can also not always show you 100%, do I have it or do I not? Another way doctors will try to diagnose this is with endoscopy, where basically, you get that tube stuck down your throat, and then they're going to take a biopsy. They're going to kind of take a little clip, maybe about 3 samples of your stomach, pull that out, and look at that. Hey, what do we have here? Do we have any problems? Do we have bacteria? Things like that. This is the most diagnostic, meaning that this is kind of the gold standard. If they find it positive there, they'll say, oh yeah, you absolutely have this. The problem is you're only biopsying these small sections. What if you miss the area that didn't have that had the H. pylori? Now you miss the diagnosis and you're like, hey, you don't have it. And then the person just continues to suffer. Oh, we don't know what's causing it. I hate to say that. And then there is a blood test for H. pylori, but that does not show up for an active infection. That's when you've made antibodies for this, because this bacteria could also potentially cause other issues in parts of the body. So diagnosis, you can try. Hopefully you'll get it. But sometimes if you have these issues and you're chronic, you might as well treat it as if. So the thing is one thing we can do too to find out what do we do, how do we treat it, is you can take some apple cider vinegar. I call this the apple cider vinegar test. Take about a tablespoon of this stuff. Apple cider vinegar may be a little less acidic than the actual stomach acid that our stomach makes, but in fact, I'll put another video up here that you can click on about apple cider vinegar, but take about a tablespoon of that, mix it with some water, drink it down. Now, only 2 things are going to happen. Either one, oh, that made my stomach burn. Oh, yikes, that didn't feel good. Or, hey, doc, I didn't notice anything. I drank that apple cider vinegar, didn't bother me at all, didn't feel a thing. That's what we'd rather have. If you notice it burns, that means the problem is not good. That means the lining of the stomach is very inflamed, or potentially there's some ulceration there. So the thing is first of all, we got to heal that before we can repair. We've got to put the fire out in the house before we can repaint and carpet, if that makes sense. So what would we do? So if you do have the burning and it's like, oh, that really made me feel bad, then you're going to go with that treatment number 1. And these are some different herbs, botanicals, different things that can help. Chlorella, glutamine, the licorice root, the diglycerized licorice is probably top 1. Now, usually what we'll use is a combination of these in a formula, so you don't have 6 different bottles of things that you have to take. So you can get this usually in a formulation. Now, if you don't have the burning, then you can do both of these things together. If you have the burning, you need to complete step 1 before you go to step 2. And again, before you ever take anything or do anything that's on any of these lists, check with your doctor. You don't want anything interacting with medications. You don't want anything that's going to make you worse, especially if you have certain health conditions. So always check with your doctor before you take anything that I have on these, out of this information that I'm giving you or anything anybody tells you. And then, so if you can go on to that more repair side, or when you don't have the burning, then you can go straight to this one, like the barberry extract, the oregano extract, the golden seal, the Chinese golden thread, the yerba mansa. So these are also things that help to deal with or manage, I guess is the best word to say, the H. pylori issue. So that's the thing, is really this all revolves, even when it comes to herbs and botanicals and supplements, it all, and even in the medical, conventional medicine, where they'll use about 2 weeks of antibiotics that's been shown to be actually not very effective. Again, it's all revolves around management. Yeah, it may come back, Mr. Jones, but we'll just do it again. So we've got to look a little further than this. So how do I deal with this further? Is, now this is something you won't ever hear about it very rarely from any doctor, is the homeopathic H. pylori isode, which just, I like it because in my opinion, it just let your immune system zap the H. pylori and get rid of it completely. But still, can it come back if you have certain issues? Yeah, let's talk about that. Because the most important factor with this is to find and deal with the cause. If you don't do that, it's going to keep coming back. You're going to keep having a chronic issue, and it's just a road to nowhere. So we have to look for cause. So the first thing you've got to look at is, how is this infection occurring? Well, number 1, let's kind of back up a little. H. pylori, or Helicobacter pylori, this bacteria, surprise, lives in everybody's stomach. Everybody has some of this bacteria. It's part of our normal flora. We need it. It's like a scavenger. But why would we get an increased amount? Why would it become infective rather than working with us and for us? Well, again, if we give it the environment to thrive, it will. It will grow. It'll start to cause problems. So the thing is if it's already in us, then there can be certain things that are wrong with us that are allowing that to happen. But also, if we get an overload of this bacteria coming in, that can cause the same thing. And that's what this first part is. You can get person to person. So if somebody else has an H. pylori infection and you kiss them, or they cough on you and some of that saliva goes in your mouth, or they sneeze on you and some of that saliva goes in your mouth, yeah, you could get a person-to-person transmission. The other one, very common, I see this probably as the most common, is pet to person. Does your dog lick you in the lips, in the mouth? Have you ever had your mouth open and you're talking and your dog comes up and licks you right in the mouth? Not just your dog, cat, horse, any pet, any animal. Hopefully, zoo animals aren't doing this. But again, these animals are large carriers of this bacteria. Now, another way is food to person. So like I was talking about earlier, if you eat out a lot, if you eat a lot of fast food, if you go to a lot of restaurants, you really increase your risk. You don't know how much something cooked. A big source of this too is undercooked poultry, but it doesn't have to be that. A lot of it is what's called the fecal oral route, meaning the person who prepared your food did not wash their hands after they went number 2. Or again, just other ways this can happen, but it can come from food to person. Now, we've got to also look at what's the real cause, because there's some people who eat out all the time. There's some people who kiss people with Campylobacter or H. pylori all the time. There's some people who let their pets lick them in the lips all the time. They don't have any problems. Why? Why do they do okay? Why don't they have any of these issues and you do? This is the real issue. We've got to look at you. We've got to look at your system. What could cause this? Because it's not a bug issue. This is an immune system issue. That's the core way you have to think about this. If you get an infection, there's a reason, because why didn't my immune system defend against that? Why can some people get exposed to a virus never have any symptoms. Some people get exposed to the same virus, same person sneezes on both of them, the other person gets sick, is in bed with a fever. Why? It's not about the bug, it's about the immune system. So that's what we have to look at. What is lowering your immune system? Yeah, could it be heavy metals? Could it be chemicals? Could it be other chronic infective agents? Let's say you got like Lyme disease or some other chronic virus like Epstein-Barr or something. And then again, it's looking for these things. Hey, what's going on here? Also chemicals. Maybe I already said heavy metals. If you're exposed to certain things during your lifetime, these things could have built up in your system and they compromise your immune system because your immune system can't kill them. They're not alive and it wears itself out trying to attack them, creates chronic inflammation. Very, very common, very little talked about by doctors. And then stress. Stress is a big one. If you have stress or trauma in your life, physical stress, emotional stress, chemical stress or trauma, any of these things lower your immune system. So what happens? Somebody says, oh, I got stressed out, it gave me an ulcer. The stress didn't cause the ulcer. The stress lowered the immune system. That opened the door and allowed this bacteria to grow, and then that progressed into an ulcer. So yeah, if you have enough stress, your immune system just crashes. Now, in someone, it may manifest as stomach ulcers, and another person, it could manifest as a whole different health condition. But this is the perspective that we have to look at, the kind of the paradigm that we have to shift to is, this H. pylori, it can be a troublemaker, but is it the cause? Yeah, so we got to look at cause. All right, well, hopefully everybody got some great information out of this. God bless, and watch this next video. I think you'll like it a lot, and it relates, and I'll talk to you soon.